Hello, my name is Robert Zeiser. I'm the director of the Division of Tumor Immunology and Stem Cell Transplantation at Freiberg University Medical Center. And I'm here at the meeting of the American Society of Hematology in San Diego. And I will report about the STARGAZE trial. The STARGAZE trial is a trial on glucagon-like peptide analog called apraglutide for acute steroid-refractory intestinal graft-versus-host disease. And the background why this trial was designed is that GLP-2 or glucagon-like peptide is an enteroendocrine peptide produced in L cells in the intestinal tract. And when mice develop graft-versus-host disease, we notice that these L cells are lost and GLP-2 goes down. In contrast, when we substitute GLP-2 in mice, we can rescue the intestinal damage by increasing Punnett cell number, the intestinal stem cell number, the enterocyte number, and thereby improve the intestinal epithelium. Based on these data in mice, we have then translated that into a clinical trial, phase 1/2 trial, which is a STARGAZE trial. And the STARGAZE trial recruited 31 patients. It was a randomized trial for different dosages of apraglutide. The main primary endpoint was safety, and the secondary endpoint was efficacy and loss of response over time. And why did we choose loss of response? This is because the combination partner for apraglutide was ruxolitinib. Ruxolitinib induces a higher response rate than best available therapy, which we could show in the REACH2 trial. However, the response goes down over time. So there is a loss of response to ruxolitinib, as it is for many immunosuppressive drugs. And we wanted to counterbalance that. And our observation in the STARGAZE trial was, first of all, that there were no drug-related severe adverse events, not a single one. So indicating safety. And then efficacy showed that initial response on day 28 was similar to what we observed for ruxolitinib. But our patients in the STARGAZE trial were different from the ruxo trial because they were selectively patients with severe intestinal graft-versus-host disease. Then over time, the response rate remained stable. On day 56, we didn't observe this decline of response. And on day 91, we even observed a similar response. And we looked at specifically GI response in these patients, saw that the GvHD response was even higher on day 91 than on day 56. So overall, the trial is promising, indicating that GLP-2 is safe to be given to patients with acute intestinal graft-versus-host disease. And there's a signal for efficacy also, which motivates us to continue to test GLP-2, the GLP-2 analog on apraglutide in clinical trials. Thank you for your attention.